for a short case, your physical examination should be smooth, efficient, and performed with correct technique. Skills that are honed through repeated hands-on practice with experienced clinicians and peers. Begin by ensuring you have already familiarized yourself with standard techniques and checklists, so that you know exactly what to look for and how to perform each maneuver. As you start your exam, focus on performing each physical maneuver correctly. Memorize and rehearse what you should be looking for in each part of the body. For instance, when you examine the hands, you might say, "I'm examining your hands now," while mentally checking for signs such as finger clubbing, palmar erythema, nicotine staining, Osler's nodes, or Janeway lesions. It's important to provide a brief internal commentary to ensure thoroughness, but avoid turning it into an exhaustive presentation during the examination. Your commentary should be succinct, just enough to confirm that you are systematically covering every critical component. Time management is essential. Aim to complete your physical examination within 7 minutes, leaving approximately 8 minutes for the presentation and discussion of your findings. Practice your short cases repeatedly with a timer or timekeeper, ideally in a group setting where one candidate conducts the examination while another uses a checklist to ensure nothing is missed. This method helps you develop a natural sense of pacing and ensures you don't run over time. In more complex exams, such as neurological assessments, you might be allowed slightly more time, but the principle remains the same. Be efficient and methodical. During the examination, maintain constant communication with the patient. Provide clear, concise instructions for each step, speaking in a natural, conversational manner that mirrors real-life clinical practice. Monitor the patient's comfort throughout the process by periodically checking in and adjusting your technique if necessary to avoid causing any discomfort or pain. While you are conducting the exam, remain mindful that your objective is not to deliver a full verbal presentation of your findings at that moment. Instead, your goal is to focus on performing a thorough and correct examination while keeping a mental note of key findings. Later, during the presentation and discussion phase, you will have the opportunity to share a detailed summary of your observations. Once time is up, the examiners will stop you and prompt you to present your findings. Therefore, it is essential that you practice delivering your physical examination efficiently, ensuring that you can complete it within 7 minutes and have ample time to reflect on and present your observations during the remaining period. By practicing consistently with both peers and senior clinicians, you will refine your technique and develop the confidence to perform under pressure. This systematic approach, using standard techniques, practicing with a checklist, and adhering to strict time management, will not only improve your performance during the exam, but also strengthen your overall clinical competence. In summary, focus on executing each physical exam maneuver correctly and efficiently. Provide brief, clear commentary to guide your assessment without overloading the exam with unnecessary details. Ensure that you complete your examination within the allotted time, allowing for a concise presentation of your findings. This structured and well-practiced approach is key to demonstrating your clinical competence and professionalism during the exam.